District 1199 President Becky Williams.
Thank you. So I want to first welcome all of you to our SEIU 1199. We are now going to call this Healthcare Reform Headquarters, Columbus, Ohio. So welcome. I want to do a special thanks to Progress Ohio that helped to organize this event, and really wanted to pay special recognition to Brian Rothenberg, the Chief Executive Director. I'm giving you a whole lot of titles today, Brian, okay? He's the Executive Director that works tirelessly to make certain that we're all fighting for change. So, Brian, thank you. I am also incredibly delighted to share this mic with some amazing people, and so I want to first let you know that right behind me is our Secretary of State, Jennifer Bruner. Back at the door is our Lieutenant Governor, Lee Fisher. We have some Ohio House representatives here today, Marion Harris and Ted Celeste, that are going to share the mic. And of course, my comrade in the fight for justice for working people, Tim Berga. And you cannot talk about healthcare reform without knowing, hearing, and paying attention to this champion of healthcare, Kathy Levine. So today we're here to do, I think, one thing, and that's send a message to our members of Congress. And I want to make it simple because I want to make sure they understand what we're trying to say. 3 basic points. In 2008, we did what? We voted for change. What does that mean? Make something different happen, right? Change our healthcare system. It's broken. Second thing we want to say to them, we expect and we need you to lead with courage. Stand up, put your shoulders back, plant your feet if you got to, and charge forward. This is a fight, and we've got to make certain that our leaders have the courage to get in it, because right now they're a little behind, and we got to make certain that they've got the courage to lead this fight. Third thing that we have to say to them, we ain't going to be fooled by the lies, the political spin, and the propaganda. Americans did not decide they don't want healthcare reform. I don't care what happened in Massachusetts. How many of you saw 2 recent polls? We had an ABC poll and we had the Washington Post. Okay, 66% of Americans are still saying they want healthcare reform. 40% of that 66% have self-identified as what? Republicans. This fight is not just about the Democrats. It's about American people need healthcare reform. It's not a party issue. And we've got to send that message. This is not just a cause, it's a righteous fight. Think about it. We have 47 million Americans without healthcare. Those that have it, how many of you have health care? In this country, we're paying 2 times more for the health care than any other industrialized country. There's something wrong about that when we're one of the richest countries in the world. And let's just think about this. Every week that goes by that they don't fix something, 44,000 people are going to lose health care. Now this next thing I want you to think about, it when you look at your neighbor beside you, or your mom, or your brother, or your sister, or your aunt, or your uncle, or your child, because this is serious. This isn't just a number. Every week that goes by, 421 people are estimated to die as a result of not having health care. We have a health care crisis that they need to fix in Congress. And here's what the plan is. So I heard Brian say that Monday they're going to open up and show this big idea they've got, and then on Thursday, the president's going to put everybody in a room and say, let's try to reach a deal. How many of you think they're going to reach a deal? Wait a minute! Who had a hand? Okay. We have at least one person that believes they may reach a deal. I, for one, I'm not sure what's going to happen. I really don't know what's going to happen. And to tell you the truth, I probably would be like you with my hands on my lap. I wouldn't have as much faith as my brother does to my right. But the truth is, they're going to get together and they're going to try to hammer it out. Probably not going to work. And so at the end, what are we going to do? We have a couple other options. I was here in Columbus last night and heard this wonderful ad put out by the right conservative, people that just don't believe in healthcare reform, and they say that labor unions cut special deals, and that the liberals like you all that traveled from Mansfield here, are just trying to make this country move too fast, and we need to slow down. We need to start over from the very beginning and redraft this whole thing. How many of you like that option? All right, so this one's a little controversial, I would guess. So then I think that our other option is, if they're not successful, we gotta take that Senate bill and we gotta say to the House that you gotta pass it and then fix it in reconciliation. People. Now some of you sitting here are gonna say, Becky, you're crazy. There are things in it I don't like. There's the excise tax. Everybody's not gonna get coverage. It's not gonna fix our problem. Well, let me tell you, I am 100% behind single payer. You couldn't get me to support something that has a greater cost. But I'm also very pragmatic, and it is not going to happen. And right now, if anybody, if I'd ask how many hands would raise to think that we're going to get something better than the Senate bill if we start from scratch, my guess is there wouldn't be many of you raising your hand. So if we don't pass that Senate bill, and we start from scratch, we lose more than what we lose if we take the Senate bill. So I think it's important that when we get on the phone, we call our members of Congress and we say, look, if you don't get it done on Thursday, you made a commitment. We need to call President Obama. How many of you remember what he said to us? He said, healthcare reform should not wait, cannot wait, and will not wait another year. How many of you want to hold him to that? How many of you are getting sick and tired of people saying they're making changes and nothing changes? How many of you know what the mental health world says about change? They say that, the person that says that they're going to do the exact same thing every single day, exactly the way they've always done it, make no change, and every day do the same thing, and then at the end expect something different, that's a sign of insanity. I'm sick of the insanity in DC. I'm sick of the insanity with our members of Congress. And I'm prepared to stand up and say they better do something different if they can't fix it on Thursday. How many of you are prepared to stand with me? Yes. Some of you drove all the way from Mansfield today. They have an obligation to lead, and we have to say to our members of Congress, we expect change. We need you to do it with courage, and we need to make certain that you do not let anybody just believe the propaganda. So I want to thank all of you for traveling out today, and our job is to make certain that we take this message to the street, and we convince our mothers, our sisters, our brothers, and our family members to get on the phone and call the members of Congress, because they are getting pressure from every direction, and most of it is to not do this. So please make certain that you get on the phone and make the calls. Thank you.